One of the common potential misinformation about older adults is that it's normal to become depressed. It's not normal to become depressed when you become older. Conditions that would make seniors a higher risk for suicide would be depression. First of all, they consider that to be one of the highest risks for suicide. Other potential risk factors could be a worsening physical ailment or a serious diagnosis of a medical condition that they're concerned about, maybe a loss of a spouse or a close social network that they're losing. Often older adults are worried about losing their independence, and they would not want to be placed in a nursing home, so there might be an increased risk of depression, anxiety, even thoughts of suicide if they feel that their life is coming to an end. And we know that one of the best protective factors as you get older and to help with longevity is the social interaction. So we really need to look at any depression that becomes apparent in an elderly individual, that we're not just kind of blowing it off and saying, well, the person is, old and they're just getting, of course they would be depressed. I would be too. Depression's not normal in the elderly population. If a caregiver, a family member, a friend is concerned that an older adult might be having symptoms of depression based on changes in behavior or statements that they're making, the best thing to do is encourage them to talk to a primary care doctor saying, hey, I think I'm getting depressed, and then starting the conversation that way. Obviously, someone could always reach out to Coleman. Even if they call Coleman as a concerned family member or concerned person, we can also direct what the person could tell that older adult to follow up with. What would make Coleman as being a standout for treating people with older adults is that we're seeing patients across the age gamut, from children all the way to end of life. So we're seeing people that have severe mental illnesses, significant health issues, and we are addressing that with a whole person approach. And when we're talking with somebody that is an older adult, we're also looking at other potential problems that might arise and other needs they might need. So if I have an older adult, or if an older adult is involved in our services, we're often looking at, if you want to continue to live independently, how can we help you do that? If it's an issue with socialization, we might encourage them to find ways to find either volunteer activities or even part-time work, or whatever they might be able to manage through the help with vocational rehab. If it's an issue of maybe needing more daytime supervision and programming, without having to go to a nursing home or an extended care facility, we could refer them to Portage County has Adult Day. So there's many different options that we would have in treating the older adult that other community mental health centers might not have.